I once went to a lecture on exercise and cancer, and the exercise physiologist said if we could give exercise in a tablet, every single person would take it. But we don't, and so therefore the motivation to do exercise can be very challenging. But lucky for us, here in Tasmania, we have one, I think, very pragmatic, very practical exercise physiologist, Katie-Jane Brickwood, who is going to bring her 15 years of experience in the public and private setting to us so we can feel like we're taking a tablet today that we're going to take for the next 100 days to change our behaviour. Katie.
Thank you, KP. Thank you, everyone, for coming along today. It's so wonderful to see a room full of people so keen to learn more about breast cancer and support the wonderful event put on by BCNA. So, as KP mentioned, I am an exercise physiologist, and what I want to talk to you today is all about exercise and the role that that plays when you are dealing with a cancer diagnosis. So, the first thing that I wanted to talk about was a statement put out by COSA, which is the Clinical Oncology Society of Australia, and this was quite a few years ago now, but basically it states that exercise should be embedded as part of standard cancer care and viewed as an adjunct therapy that helps us to counteract the adverse effects of cancer as well as its treatment. So what this is really saying is that exercise isn't really an optional extra anymore. It's something that should be a standard part of treatment, just as chemo, radiation, hormone therapy, surgery, whatever you end up having along your journey, exercise should be included as part of that treatment. So, flick through all of those, but basically we're all here coming from a very varied background and a very varied journey. So whether it's surgery, whether it's chemotherapy, whether it's radiation, whether it's hormone therapy or any combination thereof, everyone in this room is going to be a little bit different or have supported someone a little bit differently through a journey. So each of those treatments come with their own little goodie bag of side effects and things that go along with that. So what I want to talk to you about today is just how important exercise is in helping to manage and combat some of those side effects. So looking at the overall picture, what we're looking at is fatigue. Fatigue is an enormous one that we deal with when we're going through treatment. Loss of muscle mass and reduced bone density are really common side effects of chemotherapy, hormone therapies, and that contributes to an overall loss in physical function, as I'm sure some of you have experienced at some point in time. On the other side, we've got crappy sleep quality as well. So when you are going through these treatments and when you are having chemotherapy, hormone therapies, they all start to affect your sleep, and all of that comes back to your reduced quality of life. And the other one in there is as well as lymphedema. So for those of you who have ended up with lymphedema post-treatment, that's another thing that all plays into this overall thing of quality of life. And the research around exercise is that it helps to manage all of those things and therefore helps to just improve that quality of life. So yeah, as I said, exercise helps to manage all of these side effects. So I just want to run through quite quickly a little bit of the research that is out there around all of the different types of exercise and how it helps all these different side effects. But what I will do before that is just quickly clarify what is aerobic and what is strength exercise. So there's a little bit of a mix of both in the next lot of research. So aerobic exercise is basically anything that gets our heart rate going, gets our breathing rate going a little bit. So going for a walk, a swim, a bike ride, whatever it might be, anything that gets you huffing and puffing a little bit. And that improves our cardiorespiratory fitness. So it's good for our heart, it's good for our lungs. Strength exercise is something that challenges our muscles and challenges our bones. So it's something we do in a repetitive nature. You would probably be familiar with like weights in a gym or stretchy resistance bands, even body weight exercises help improve our strength. So these are the two really important components of exercise, and what I personally consider to be the non-negotiables of exercise. You know, there's lots of other modalities of exercise that can be beneficial, but aerobic and strength exercise are really the two non-negotiables. So first up, just want to have a little chat about fatigue. So what I've got here is just a few little research papers that summarise why exercise can help with fatigue. So what we see is that higher intensity exercise can help during chemotherapy, can help reduce cancer-related fatigue, improve strength, improves quality of life. Down to seated exercise, which can help manage fatigue and improve physical well-being while undergoing chemotherapy for advanced breast cancer. So, you know, you've got the higher end of the higher intensity stuff down to the seated exercise that can be beneficial. We've also got there that exercise improves quality of life, fatigue, physical function and sleep quality in those with metastatic breast cancer. We've got aerobic and strength exercise improves cancer-related fatigue and pain, particularly in hormone therapy, and even exercise while undergoing radiation decreases fatigue as well. So that kind of covers off the majority of the different treatment modalities, but no matter which modality the fatigue comes from, exercise has benefit. There is actually also a study, and I forgot to add it in, that a single bout of exercise can actually improve chemo-associated fatigue. So that's just from one bout of exercise, can actually help to reduce that immediate fatigue. Loss of muscle strength. So this is one that we probably don't necessarily think about as much as the fatigue, because you don't necessarily feel it in the way that you do fatigue, but it's still really, really important, because when we lose muscle strength, we lose function. When we lose function, we stop being able to do the things that we love, and that's never a good thing. So we know that both aerobic and strength exercise can improve or maintain muscle mass during cancer treatment. Even low dose exercise, so that's just, you know, once or twice a week, can improve muscle strength during chemo. Exercise can preserve lean muscle mass in metastatic cancer. Combined strength and aerobic exercise improves body composition, and improves lean muscle mass, so that's the stuff that keeps us strong. And exercise during radiation treatment, again, improves physical function. The next one we'll look at is bone density. So this one probably gets a little bit more attention. Oops, hang on. So we all know that bone density is related to having an increased risk of fracture if you have a fall or something like that. So chemotherapy, radiation and hormone therapies in particular do have a pretty significant impact on our bones. So we need to do things that help to mitigate those side effects of the medications or treatments we've had. And that involves weight-bearing exercises that help to load up our bones. So weight-bearing aerobic and strength exercises can maintain bone density during chemo. Strength exercise improves bone density following cancer treatment, and a combination of aerobic and strength exercises can prevent bone density loss during hormone therapy as well. And that's probably one of the bigger ones that we see. As we heard from Michelle earlier, chemotherapy does have a pretty big impact immediately on our bones, but when you're talking about taking hormone therapy for 5-10 years, it really needs to be something that we include in our approach. Next up, we have sleep quality. So when we're looking at sleep quality, we know that exercise improves sleep quality while undergoing radiation. Exercise improves chemotherapy-induced sleep disturbances. Higher volumes of exercise, so more exercise and a combination of strength and aerobic can be really beneficial not only for sleep quality but also for sleep duration. And something as simple as regular walking can reduce sleep disturbances while taking hormone therapy. So next up we have lymphedema. So lymphedema is something that can happen following treatment, particularly surgery, and is something that if you do end up with lymphedema needs to be managed in an ongoing basis. I just need to preface this by saying that strength, aerobic, whatever type of exercise is safe in people who have lymphedema, and it does not increase your risk of getting lymphedema either. It actually reduces the risk of you getting lymphedema if you're physically active. So we used to think that we needed to be a little bit cautious, but now we know from the research that lymphedema and exercise go hand in hand. So that's the safety side of it. Strength exercise has a positive effect on arm function, symptoms, improves quality in life in those with lymphedema. Higher frequency, so we're talking sort of daily exercise, is associated with a greater reduction in the severity of your lymphedema. And when it comes to compression garments, it's really up to the individual. So there's not actually any research to show that you have to wear compression garments during exercise. It is completely your choice. So Sandy Hayes is the author of that 2020 paper. She's an Australian researcher, and if you're finding exercising with a garment on is hot and sweaty and uncomfortable, then you can be safe in the knowledge that you can generally do so without, and then just pop your garment back on after you've completed your exercise bout. Does anyone have any quick questions as I go through? Yes.
What's the difference between you're saying strength training and weight bearing?
Yeah, thank you. So the question was, what's the difference between strength and weight-bearing exercise? So they're similar. So they're both things that put load through our muscles and bones. So strength training would be more like lifting weights and doing repetitive exercises. Weight-bearing or load-bearing exercises are things that actually put an impact force through your bones. So walking downhill, jumping, running, things like that, where you've actually got that impact force. Yeah. Oh, there's another one.
What about cording?
Cording? Yeah, cording, great question. So with cording, are you talking about the safety?
No, exercise associated with trying to
Reduce it?
Yes.
Yeah, so usually range of motion stretching exercises are really beneficial for helping to minimise cording. You'll find that you might be a little bit restricted in your range of motion with your strength exercises, but yeah, range of motion and that sort of thing is definitely a good approach for managing cording, yes. Another one down the back.
I was just wondering if you know anything about taking hormone inhibitors and the capacity to put on muscle mass with so much reduced estrogen.
It is still possible to maintain muscle mass while you're on aromatase inhibitors or tamoxifen, absolutely. It's harder, there's no doubt about it. And I'll get to that bit and we'll talk about recommendations in a second, but yeah, absolutely, it is still possible to build muscle mass with those medications on board. So when it comes to, was there another one? Sorry,
can you do too much?
It depends on the stage of where you're at. When it comes to doing too much, that would be something that you'd need to consider in terms of your immune function if you're on chemotherapy and your fatigue levels. Obviously you can do too much post-surgery because you can do some damage to your surgical site, but it's quite uncommon for us to see people doing too much. But yes, it is possible if you're not managing the fatigue. It can go the other way because of the impact that exercise has on your immune system as well. As a general rule, it's positive, but if you're doing repetitive, very frequent, higher intensity exercise, it will have a negative effect on your immune system. So it's about balance. So when we're looking at the recommendations, as I said earlier, aerobic and strength exercise is what we're looking at. So our National Physical Activity Guidelines suggest that we should be doing between 150 and 300 minutes of moderate intensity activity. So what we mean by moderate intensity, stuff that gets your heart rate up, stuff that gets your breathing rate up. And then we have that higher intensity stuff. So that's the really you've just walked up a hill and you can't quite catch your breath. That's that higher intensity sort of stuff. So it doesn't have to be one or the other. It can be a combination of, but anything that gets your heart rate up is going to be beneficial. When it comes to strength exercise, the national recommendation for our general healthy adult population is twice a week. For those that are on hormone therapies, those that have been through chemo, radiation, etc., I would say minimum would be 3 times a week, just because you're working against the odds to a degree, so you need to put a little bit more in. So yeah, about 3 times a week would be ideal. So that seems like a lot, and it all seems a bit overwhelming, doesn't it? Yeah. So what we generally talk about is starting small, and always remember that something is better than nothing. So even if you're deep in the midst of treatment, you feel like absolute rubbish, just, you know, getting up and doing a few laps up and down your hallway or around your kitchen table is always going to be better than nothing. So, you know, start small, start with what you can manage. If you were highly active, you know, before starting treatment, chances are you'll be able to get back there relatively quickly compared to someone who wasn't active beforehand. So it really does depend on what your starting point was, but just remember, something is always better than nothing. The other thing too is focus on priority areas, because if you try to do all of the things that you should be doing, you'll get really overwhelmed and, you know, you just throw your hands in the air because it's all too hard. So, you know, you might have just been post-surgery, so your focus might be getting your range of motion back in your shoulder because you've got radiation coming up and you need to be able to pop your arm over your head for your radiation. That focus is getting that range of motion back, or minimising your cording, or whatever it might be, through to, you know, you're currently in the midst of a chemotherapy cycle, and what we know is that aerobic exercise is more important when you're having those infusions of chemotherapy compared to later on in your cycle when it might be strength training focused. So it's just sort of, yeah, choosing those priority areas rather than trying to do all of the things all of the times, because you just get overwhelmed and it's too much. So just quickly some considerations to think about. So when we're looking at post-surgical, range of motion exercises are usually started quite quickly following surgery. You're usually given a little handout of exercises to do, and you can slowly build up once you get over those initial few weeks. And yeah, basically gradually build up. If you do develop a seroma, it's really important to speak to your healthcare professional team, because that might need to be drained, and it can have a pretty big impact on your ability to exercise. So it's really important that they're managed early on. Chemotherapy, as I sort of touched on earlier, immune system is compromised, so we just need to be careful in terms of the increased risk of infection depending on the environment that you're exercising in. You know, if you're used to going to a commercial gym, it might, you know, need to back off that for the time being, just because of the increased risk of infection and things like that in those settings. Things like neuropathy as well, so if you've got any chemo-induced neuropathies, particularly in your feet, that's going to affect your balance and your some of your ability there, so that's just something to be aware of. Radiation, so as those that have had radiation know, that skin's going to become a lot more sensitive at that time, so we just need to be careful that we're not doing anything that compromises the integrity of your skin. Some people also notice that you get a bit of a reduced range of motion in your shoulder when you're going through radiation, and that's just because the radiation sort of tightens everything up a little bit, and so working on exercises to keep that range of motion throughout your treatment can be helpful as well. And finally, hormone therapy. So, you know, for any of those of you that are on hormone therapy, we know the long list of side effects that come along with that. You might get an increase in joint pain. Sleep disturbances can be really challenging, because when you're not sleeping well, you're not feeling your best, and you certainly, exercise isn't high on that list. But it is also really important to be aware of that bone mineral density. So hopefully your oncology team did a bone mineral density scan at the start of your hormone therapy treatment, so we know where you're at and you've got a baseline, and that's just something that we need to monitor going forward, just to make sure that it's it's like maintaining or heading in the right direction. But exercise is safe at all stages of treatment, even in metastatic cancer. And I say that because the number of times I get people referred to me and I'll ring them to make an appointment and they'll say, oh, I just need to finish my radiation treatment and then I'll start, or I just need to finish this cycle of chemo and then I'll start. And the truth of the matter is that you really need to be doing it during treatment, if at all possible. And, you know, I recognise that most people in this room are probably heading towards the post-treatment side of things, not necessarily, but yeah, it's it's just trying to get that message out there that we don't recommend rest and taking it easy during active treatment anymore. We want people to still be active and still engage in exercise. And again, that's going to look different for everybody, and that is okay. But as long as you're just trying to maintain some level of activity during your treatment, then that is going to go a long way to helping you manage your side effects. So it's really just being about, appropriate intensity, appropriate type of exercise. And again, that's going to differ for everyone. But this is where that appropriately supervised exercise comes into play. So whether it's a referral to an exercise physiologist, whether it is a referral to an oncology trained physio, we're there to sort of support and guide you on what is appropriate, what is safe, what's going to give you the biggest bang for your buck in terms of right now, because I just can't stress enough how important exercise is when we're going through treatment, but also living with cancer and also recovery from cancer as well. So always, if you're unsure, seek support, seek advice. We have our lovely breast care nurses somewhere. There they are. There we go. They're a fantastic resource. They're going to know the local area really, really well and be able to link you in with services. So you'll hear from those guys in a moment. Cancer Council is another really great resource. Some of the local cancer councils, I know up in Launceston, we have exercise groups that run through the Cancer Council, which are at no cost. And obviously the Breast Cancer Network Australia have got a lot of various resources and articles. And so this is just an example of one of the articles up on the website. When it comes to funding, it can always feel a little bit tricky as well. So what you all will have access to is what we call a team care arrangement or a care plan. This is something that you access through your GP, and it entitles you to 5 visits with an allied health professional per calendar year. So in order to qualify for that, you need to have a chronic health condition, which cancer ticks that box. But you can get this in place, and it gives you Medicare subsidised access to health professionals. Some will bulk bill, some won't, but it will reduce the overall cost for you. Private health insurance, for the most part, private health insurance will cover both individual and group exercise services. So that's worth investigating if you do have private health insurance. If you are old enough to have a home care package in place, that can be also a really useful thing as well, because depending on the level of your package, you can actually use some of those funds towards exercise supports as well. So I'm a Launceston girl, so I had to reach out to a couple of my colleagues down here in Hobart. So two fantastic options, and both the team at Your Path to Health and Hobart Exercise Physiology are fantastic. So Your Path to Health is a multidisciplinary team. They have exercise physiologists, physios, podiatry, dietetics, all of the things. And they have a site at Belrive and Derwent Park, and they do one-on-one and group exercise sessions. Hobart Exercise Physiology are located in South Hobart and are exclusively exercise physiology. And again, group and one-on-one options available. They do have a little offer for cancer clients where it's $160 for an initial assessment and 5 group exercise sessions, when I think it's normally like $150 for an initial assessment. So it's a little cost saver there if that's suitable for you. So I'm nearly out of time, but any questions? Talk too fast.
This might be kind of a how long is a piece of string question, but you said, doing strength exercises 2 or 3 times per week, and I'm not really a very good exercise person. So how long would a session be to be classed as a session?
Yeah. That is a great question. So, it really, as you say, it is a bit of a how long is a piece of string. It does really vary. But if you can do 15 minutes, that's fantastic. Like, that's a really good start. So if you can do probably 4 or 5 different exercises working on the different muscle groups, and that, takes you 10, 15, even up to 20 minutes. That is perfect. Like that's going to be giving you benefit, absolutely. In one of the research studies back at the start, even low dose strength exercise will help to improve. So yeah, so anything is good. There's one in the middle, Ellen. Sorry.
Have you got any suggestions as to how we can integrate exercises into our daily lives without going to special sessions, paying lots of money?
Yes.
Da-da-da-da?
Yeah, so there's definitely advantage in incidental activities. So, when you stand out of a chair, sit back down, stand up, sit back down, as I'm sure KP's had you do today. So, those sorts of things you can integrate throughout your day, walking, all of that sort of stuff. Incidental activity, though, doesn't replace dedicated strength exercise. So even if you don't have to go to a gym or go to special classes, you can even just have one appointment with an exercise physiologist, and they will set up a home program for you, and you can just incorporate into your routine 10 minutes at the start of your day. And I know at the Devonport one on Tuesday, we had someone ask, how do you stay motivated? And it's a fantastic question, and if I had the answer to that question, I'd be very rich, I reckon. But it's really about habit, and it's really about routine. So if you can get into a habit and a routine of doing 10, 15 minutes of exercise, 3 mornings a week, yeah.
Actually, I was thinking of what you do every day. And
Yeah.
I mean, why is it because people tend to sit in front of computers all the time or televisions? Because I would get far more in my daily life.
Yep.
Climbing 3 flights of stairs.
Yep, and all of
multiple times a day.
all of that stuff is very valuable.
Doing housework, gardening.
Yep, exactly.
Carrying heavy things.
Yep, carrying groceries, all of those sorts of things are absolutely valuable, and they should
Walking
be
to the supermarket and back.
Yep, exactly. So if you can, replace a short drive with a walk, if you can, take the stairs instead of the lift, and all of those little things that we do on a daily basis, they absolutely accumulate to our overall improved physical activity levels. But when it comes to improvements in strength through, especially when you're up against it with previous cancer treatment, for example, it is additionally beneficial to have that dedicated strength exercise. So it's an and rather than an or, if that makes sense. Yeah. Okay. We've got one at the back. We're going to be very fast.
It's a very obvious question, but when would you recommend that people start doing dragon boating? Do you know anything about dragon boating?
Love it. So whenever they're feeling up to it. So the biggest inhibitor is going to be a surgical incision, and once they've got the range and are feeling comfortable, go for it. Fantastic exercise.
And the perfect way to end the session. Please
Thank
thank
you.
Katie. Well done.